Last question for you. In terms of caregivers, the people, the spouses, the parents, the roommates, the siblings who, they're there. They're part of this situation where there's someone with a diagnosis in their lives dealing with a psychotic disorder. Where does the caregiver go for information and support?
Well, the caregivers can go to two places. Again, one of the problems can be that some psychiatrists and other clinicians will have this idea that confidentiality is absolute. I cannot say anything about the patient's illness to somebody without the express written permission of the patient, which is, from my point of view, a very foolish notion if the person with the illness is living with his parents or another caregiver and has many symptoms, and the caregiver is responsible for assuring treatments of different sorts, paying rent and what have you, and that person has no information about what's going on. I find that is completely illogical. So it's important to share information, in general, psychoeducation, but also it's important to discuss clearly if there is a problem, what can be done. Has the patient, has the person with the problem gone downhill enough, according to the caregivers that know that person much better than the clinicians do, enough that we should have an intervention, either a hospitalization or a treatment order or something of that sort involving long-acting injectable medicines. So it's very important to have them involved in the conversations. I know this is a very touchy point because of confidentiality, but I would make an argument that in this circumstance, a lot of that is illogical and in fact damaging for the patient. I think it's very important to keep a hopeful attitude and a recovery-oriented attitude to treating people with serious psychotic disorders. They are serious illnesses. We do have treatments that, for the vast majority of people, are actually very helpful. The problem is usually in applying them in a timely way, fast enough that we prevent deterioration, which will occur if we know we don't apply them in a good enough way. And also advocating for people to have the services that we know are helpful, but which are not available because of budgetary difficulties, such as many of the psychotherapy services, supported work, cognitive remediation. We know these things work and are helpful, and yet in many instances they are just not even on the radar with respect to what services are offered to individuals with psychosis. So another important area of getting help is in organizations whose mission it is to help caregivers, that is, family, friends, even to a certain degree, the patients with illnesses, get information, advocate for services. And there are organizations like this in most countries, in most places. And of course, AMI-Quebec is one of them here in Montreal.
Well, thank you very much, Dr. Bloom, for being with us today.
It's my pleasure.
And check back with us on our YouTube channel for AMI-Quebec for further information on ongoing YouTube series with experts in the mental health field. And all of our information is on our website. Check us out at www.amiquebec.org. Thank you.